Universities say it's their top priority. Keep students safe, especially in light of the pandemic. But some may not even be tracking the problem.
Yeah, we're talking about a tough issue here. Mental health of students in colleges and universities that sometimes result in tragedy. Investigative reporter Candice Nguyen digs into this difficult problem and finds out what's happening at our local schools.
Although rare, suicide has been the second leading cause of death among college-age students for years, according to the CDC, and the pandemic has compounded things. We investigate a new call for schools to better track the growing threat and the challenges institutions face. The first day of Mariana's freshman year at UC Berkeley meant traveling from her hometown in Puerto Rico.
I live like 2 plane rides away.
To a dorm room and a desk, isolated for months.
I was basically just stuck in my dorm all of the time taking my classes.
Her first semester started during the COVID-19 shutdowns. She barely saw anyone.
The lowest point for me was probably in October. I was considering suicide, but I didn't reach out to anyone.
Eventually, Mariana did reach out and connected with other students. She was surprised to learn she wasn't the only one struggling with such dark thoughts.
Which is really upsetting, obviously, and I don't think it's being paid attention to enough.
Last year, the U.S. Surgeon General cited national surveys showing alarming increases in mental health challenges among young people right before the pandemic, the result of a bombardment of media and pop culture messages eroding their self-worth, plus distressing issues like climate change, income inequality, and racial injustice. When the pandemic hit, things got worse. A 2020 Texas A&M University survey found 71% of students reported increased stress and anxiety due to the COVID-19 outbreak. Chief Clinical Officer Nance Roy with the JED Foundation agrees with these findings. The mental health nonprofit works with universities nationwide.
Of course, the pandemic caused a spike, but it's a real thing.
With a student mental health crisis widely acknowledged, we wanted to find out how the schools themselves are tracking the problem to help address it. We sent out our own survey to these 5 local universities. We found all of them provide mental health resources, and some have increased counseling and crisis services. But when it comes to tracking student suicides and attempts, the results were inconsistent. USF responded saying it does track, adding they had 4 attempts last school year, more than any of its 3 previous years. San Jose State said they also track, but declined to provide specific data, saying they have about 2 suicides per academic year. UC Berkeley says its police department tracks, reporting 4 students ending their lives since 2020. SF State did not provide specifics, saying universities in general struggle to collect data. And Stanford responded saying it's seen a sharp increase in demand for mental health counseling. Stanford never directly answered our questions about whether it tracks student suicides. This is the same university where 4 students ended their own lives in the past 2 years, including star Stanford women's soccer captain Katie Meyer. None of the universities we reached out to with our survey agreed to an interview with us.
Do you think universities should be required to track this information?
I do, actually. I think if we really want to put a dent in reducing suicide, the better we can target our efforts to either places on campus or groups of students on campus who are at higher risk or present higher risk environmentally. I do think it would need to come from, for example, the Department of Ed, any kind of requirement on reporting.
In a statement to the investigative unit, the U.S. Department of Education said it is concerned about the rise in mental health challenges across the country. We value transparency, but also recognize the sensitive nature of reporting. The department says Congress considered several bills that would have added a mental health component to the Clery Act, which is a federal law requiring colleges and universities to report crime data. But none of the proposals passed. Mariana says it's this kind of inaction and, in some cases, silence that makes students feel more isolated. She says her school didn't provide information to students about a suicide last year, and those who heard about it had to rely on rumors.
It broke my heart. I just couldn't focus at all.
Did you get any information about those rumors or any clarity from the university?
No, we didn't hear anything from the university. Since I was going through something similar, I was like, oh, so they're just not going to care if something happens to me.
UC Berkeley declined our interview request, but says its police department does not proactively share student death information publicly. If you are in crisis or know someone who is, there is help. You can call or text 988. We've also provided a list of resources on our website, NBCBayArea.com/investigations. With the Investigative Unit, Candice Nguyen, NBC Bay Area News.